Everybody, this is Shelly and I have a tree in the background. You see my tree? I am in a meditation room at a hospital that I work at. It has a digital fish tank and a lot of fun 3D animals on the wall, which is great. And I am here to do an interview with a coworker who is a research nurse. And many people don't really know what a research nurse does. When they think of nursing, they think of taking care of the patient in the bed, charting, giving medications and everything like that. But there are a lot of different roles of nurses. And so we're gonna learn today about the research nurse. And I am inside the hospital. This is a chapel or a meditation room, and I am interviewing a coworker of mine. Her name is Jensina, and she is a research nurse, and she has agreed to answer some of my questions so that you and I can both learn more about the role of the research nurse. So here is Jensina.
Hi, everyone.
All right. Hey, Jensina, why don't you share about your nursing journey?
Sure. So I took a kind of a longer path. I got my original degree in, I got my bachelor's in sociology. And then about 5 to 7 years later, I decided, yep, I do want to go to nursing school. So went to nursing school, started with an associate's degree and then did an RN to BSN program. And yeah, I've been a nurse ever since. Passed my boards on the first time, so I'm really proud of that. Very nerve-wracking. So yeah, that's my path.
Great. And how did you end up becoming a research nurse?
So I worked in research actually while I was doing my bachelor's degree at the University of Minnesota. And at the time I was working at a clinic, and one of the doctors there got a big NIH grant, and I started coordinating his research study. Didn't have any background, but luckily I got connected with really smart people in the field of research that helped me on my path. And then when I went to nursing school, I took a step back from research and did some inpatient work. And then I found my way back to research nursing here in Minneapolis, working mainly with pediatric patients. Mm-hmm.
Great. Well, tell us about your role as a research nurse. What exactly do you do kind of on a day-to-day, week-to-week basis?
Yeah. So right now I'm working with the pediatricians at the hospital that I work with. And essentially, a lot of our research is investigator initiated, meaning it doesn't have a whole lot of funding behind it. It doesn't have, usually a lot of money. So we're looking at, growth and development. We're looking at certain disease groups that necessarily aren't studied a whole lot, and there might not be a whole lot of treatment for. There's a disease called congenital adrenal hyperplasia that some kids you're born with it. It's a genetic disease. And we're looking at, finding better treatments for them. Right now they have to take medicine all throughout the night, which can affect their quality of life. So we're constantly looking for new ways to help them, as well as not having to go to the nurse's office, 3 times during the day. Some kids really don't like to do that at all. And plus it distracts them from their schoolwork as well in their normal school day. So basically, we get these protocols, and we just have to make sure that all of the protocols are followed, as well as before we roll out the protocols, making sure that it's actually feasible. I think sometimes, sometimes physicians can have this great idea and they think, this is gonna totally revolutionize, how we do things. But if we can't actually get the work done, or nobody will ever want to sign up for that study, that presents a giant problem. So there's work on the front end, there's work actually getting the assessments done, and then afterwards looking at the data, analyzing and writing up a paper. Mm-hmm.
Cool. I gave her a list of questions ahead of time, but I'm going to throw one in to see what you say. But how closely do you work with that pico question?
Oh yes, very closely. So I think, the thing is I remember back to when I was in school and, you know, doing things like pico and all of that kind of stuff and thinking, oh, well, like in the real world, do you actually use this? And I think for sure in research you do, but I also know working inpatient, you're constantly thinking through like, okay, this is why I'm doing this. This is why I'm doing this. And maybe, you know, in school you're verbalizing all of that, but out, you know, when you're actually practicing as a nurse, you might not be verbalizing that out, but it's all happening internally in your brain. And that's why you're coming to the good decisions that you're making and the good plan for your patient at the time, whatever that might be.
All right. So Jensina, what do you like best about being a research nurse?
So I think it's very exciting to be a part of something proactive in medicine. I feel that so many times, you know, as a nurse, you're getting a patient, especially in the hospital, you're getting a patient that has had, you know, suffered some sort of calamity or, you know, progression of their disease or whatever. And you're reacting to that, right? Well, research really kind of takes a flip look at, you know, okay, we see this problem in this patient population over and over and over again. How can we make that better? And, you know, sometimes it doesn't, you know, sometimes the best laid out plan, it doesn't do what you think that it's going to do. But even that can be seen as positive because then you know, well, that's not the way to go. You know, so we've crossed that off. Let's look at another reason. So I think that's my major excitement working in research is just that proactive side of research. It's really nice. And working with, you know, all different types of people. You're working with the inpatient nurses on that unit. You're working with the physicians. You're working with NPs, PAs, RTs. You know, it's just something new every single day. So I really, really enjoy that. It keeps me on my toes.
So you've been doing this for a few years now. What is the most interesting study where you've gotten really good results that you can share about?
So actually, we don't have the results yet, but actually I have two favorite studies. So one of them is actually looking at our, you know, very, very small patients, looking at how they grow and how they develop. You know, now we can save babies very, very early, but sometimes those babies go on, you know, to develop some pretty lifelong problems that they'll have to, you know, live with their whole entire life. So finding a way to help those babies maybe alleviate how those problems from even happening is really exciting. And not only getting to work with very small patients, but also getting to work with their families. It's really exciting to provide, you know, like a little bit of hope to them as well, you know, and also for, you know, we've had patients too say, or parents of patients say, you know, maybe the outcome wasn't as good for their child, but they feel like their child may have helped a child in the future. And that is very, very meaningful to them. The other study that I work on that is really exciting to me is actually for a very rare disease called MPS IIIA or Sanfilippo syndrome. So this is also a genetic disease that kids kind of up until the age of 2, they're kind of functioning normally, and then their parents kind of start seeing some hyperactivity, kind of like defiant behaviors, and so there's no cure for this disease. You know, people that have this just kind of progressively get worse and worse and worse, and usually by the time they're in their teens are kind of in more of like a vegetative state. So we're looking at, you know, actually a neurosurgical procedure that could maybe help stave off or slow down that progression. So that was really, really exciting because I had never been in the OR as a nurse, so I got to be there and see that, and it, you know, it was our first surgery was actually kind of like emotional almost because, you know, maybe now this kid has a little bit of a fighting chance.
That's cool. Well, my last question for you is just to talk to the students about why it's important to study research. They actually have a research class 1, and this is research class 2, so they have a lot of research. And for some students, they can get into it, they really understand it. I know for some students, this can be kind of dry. It doesn't seem as meaningful to them as some of the other more hands-on nursing classes, but research is very important. Can you just share your opinion on why you think it's important for students to learn?
Yeah, it's been said time and time again that, nursing is one of the most trusted professions. And I think in my experience, that's true. Your patients will look to you to answer questions, and they will look to you and they'll trust you. They'll trust that you're giving them the correct information. So it's very important for us to continue that knowledge of what is new in terms of treatment? What is, what's the up and coming thing? And is it safe? I think where I work currently with pediatrics, we work super close with the bedside nurses because we know that those parents and those parents are definitely asking those bedside nurses questions about, hey, should I participate in this? What do you think about it? Because they're really seen as that expert person. So I think, whether you're, a research nurse or you're, a bedside nurse or whatever kind of nurse that you're going to be asked questions about research, and patients are going to trust you to give your honest, knowledge about the research. I think, it's healthcare. You'll learn healthcare is a total, everybody needs to be involved. And I think for our patients to have the best care, that's certainly important. And for our patients to, maybe now they don't have a cure, but maybe in 5 years we'll have a cure. And the reason that we have that cure is because of that medical research that's being done. But patients need to feel safe. So I think that that's another exciting thing about being a research nurse, is because I have always put it upon myself, whatever study I participate in, I need to make sure that those patients are 100% safe, because I won't feel good if something bad happens and I could have prevented that.
Great. All right. Thank you, Jensina.
Thank you.